Paging Dr. Renzo Corzano, please report to your office for episode 14 of Ask a Gay Doc.
It's a beautiful day in the gayborhood. A beautiful day for another episode of Ask a Gay Doc with Dr. Renzo Corzano of Desert Oasis Healthcare.
Hello. Hi.
Hello. We're going to be talking about probably the fastest growing in sales, at least, a drug category that's come on the market probably in our lifetime.
We're going to talk about weight loss medications, something like Ozempic. We'll talk about what that's actually used for, the Mounjaros and things like that. So the injectable weight loss medications.
Now, these were originally supposed to help with blood sugar management for diabetics, correct?
Exactly. So what they are, they introduce a peptide that you already have naturally, but they kind of modify it so it kind of lasts a little bit longer in the body and stuff. And so the one that everyone's heard of is called Ozempic. Okay, that one is for diabetes. And then the exact same compound called semaglutide is sold under Wegovy for weight loss. These are called GLP-1 receptor agonist peptides. You inject them in your abdomen subcutaneously once a week.
So the only difference between the two is the marketing song. One is Ozempic, and the other is Wegovy.
Exactly, right. And they come in different doses as you progress up the dose range, but they're exactly the same medication. And then for semaglutide, which is this drug that we're talking about, there's an oral medication called Rybelsus, which is actually only for diabetes. And then there's also a newer class of these medications, which is basically the GLP-1 that Ozempic is. And they're adding another peptide called a GIP. And that's basically Mounjaro, which is for diabetes. And the exact same medication being sold as Zepbound for weight loss.
Now, for a patient, what kind of criteria do they have to be eligible to be on these drugs?
So solely for weight loss benefits, we usually try to put people with a BMI of over about 27, which technically puts you in the overweight category. But usually anybody with a BMI of over 30, which is considered obese, would be a candidate for this. If we're talking solely weight loss without diabetes, that's the criteria we're going by. The other thing we have to ask patients is any history of a specific type of thyroid cancer called medullary thyroid carcinoma or multiple endocrine neoplasia syndrome. These are very specific things. If a patient or anybody in their family has ever had it, like they usually are pretty aware of that. And so that's kind of one of the things that we screen for before we start these patients on anything like that.
And so when somebody starts on this, what happens that makes them lose weight?
It works by slowing down like your gastric emptying. So it kind of tends to keep food in your stomach a little bit longer. And so what that does, it also triggers like this feeling of feeling full. And so it basically tells your brain to stop eating so much. One of the side effects of that could be constipation.
Ooh.
So we always advise people that if you are getting constipation, let us know or start yourself on some over-the-counter constipation medication. A lot of the side effects tend to go away the longer you are on the medication. And that's actually one of the reasons why we start you on the lowest dose possible to make sure you don't have these side effects. Because it slows down your gastric emptying, one of the side effects could be nausea and vomiting. However, they're very minor. People that have these side effects in extreme are very rare. One thing that tends to happen is a lot of people are used to eating a lot. You're no longer going to be able to eat that. I always tell my patients, whatever you're going to eat, try to eat half of it and don't keep pushing yourself, because if you keep pushing yourself, you're going to vomit.
That'll ruin a date.
Oh, absolutely. I always tell my patients, it's not about getting to the highest dose as fast as you possibly can. Because if you do a slow taper and you're losing weight on the lower doses, it is to your benefit to stay on those lower doses because you can actually maximize how much weight you end up losing overall.
If you're on these drugs, Dr. Corzano, do you get off of them or stay on them for the rest of your life?
That's a really good question. Usually you have to stay on them in order for them to have that benefit of, weight loss and sustained weight loss. But the way that I see this, and I know a lot of providers look at it this way, obesity is a disease. It's kind of like diabetes, high blood pressure, high cholesterol, or any kind of heart issue. People take medications to control those diseases. So why not use medication to help with obesity? This works long-term with very minimal long-term side effects.
Eating is a chronic condition.
I'm not saying that everybody who's obese has an addiction to food, but the people that do have that, think about it, right? If you're addicted to alcohol, you don't have to drink alcohol to be alive, right? If you're addicted to heroin, you don't need that to be alive. But if you're addicted to food, you need food to live, right? You use this medication and retrain your brain to know what a portion is. It's just a way of retraining people, and this is a huge tool to help people achieve their weight goal.
All right, what about Ozempic butt?
So that's the other thing. It has to do with the rate at which you're losing weight, right? So I think a lot of those side effects that people are calling Ozempic butt and
saggy butts that
butts
are no longer juicy booties.
It could be just because they lost weight very rapidly without introducing some kind of muscle building exercise in there. We have to have these conversations with our patients. The more rapidly you lose weight, the more likely you are to have some kind of saggy skin issue.
I've known some people that have taken these types of drugs, and it has definitely changed their relationship with alcohol.
Yes. So right now they're doing clinical trials to see how Ozempic can be used to curb alcohol cravings.
Wow.
It's amazing. Yeah, no, these medications, I'm very pro these medications, but everything in moderation and with the right kind of monitoring. The good thing about it is it's really changing the way that we're managing obesity and diabetes. I mean, we really are seeing results, A1Cs, which is the tracker for a diabetic, they're dropping. People tend to lose weight on these drugs. So a lot of things get better, like their blood pressures get better and all that. The one thing that I am having a hard time with, and I think it might be with a population of patients that I deal with, is cost, because they're very expensive, these medications. For me, because we work with a lot of Medicare Advantage patients, coverage long-term within a year, because we get into, like higher copays and all that stuff. That's kind of been the challenge here.
You would think, just from a dollars and cents fiscal responsibility, that Medicare should pay for this, because if you lose the weight, you stop being obese, you stop having high blood pressure, you stop having the strain on the heart attack, the bypasses, all of the things that come
all
with
the cost savings long-term that you have by preventing all that stuff. Yeah, I think about that all the time.
Dr. Renzo Corzano can be reached at lgbtqhealth@mydohc.com. This is a real fascinating breakthrough that is changing lives. We appreciate having you in the neighborhood. Ask a Gay Doc is a service of KGAY 106.5 and 92.1 and Desert Oasis Healthcare.
Your health, your life, our passion.
Hey, it's John Taylor. Thanks for watching our video. And don't forget to like and subscribe to our KGAY channel so you won't miss anything going on in the neighborhood. And you can always listen live to KGAYPalmSprings.com.